Good morning to all. Good morning to all. So today's topic is facial nerve. Okay. So what are the content of the class? Introduction, functional components, course of the nerve, branches, and applied anatomy. First, introduction. So is belongs facial nerve belongs to peripheral nervous system. It is seventh cranial nerve. It is nerve of hyoid arch. It is mixed nerve. That means it is having motor and sensory component. So when you see the different segments of the nerve, so facial nerve, there is something known as intracranial component. Then there is meatal component, labyrinthine and tympanic component. All are belongs to infratemporal component. Okay. So next is mastoid component and extratemporal component. Okay. Now here, why these different components? So these different components are because facial nerve is passing through different structure. Okay, so different name will be there. Now what are the functional component? So functional component, there is spatial visceral efferent. That means efferent means motor. So spatial visceral efferent. So the cell bodies lies in the motor nucleus of seventh nerve and they supply the muscles of facial expression. Okay. Another is general visceral efferent. So efferent again motor. So that is the nucleus is lacrimatory and salivatory nucleus and it will be supplying lacrimal, sublingual and submandibular gland. Other is spatial visceral afferent. That means it is sensory. So the fiber will be reaching to the geniculate ganglion. What does they carry? They carry the taste sensation to anterior 2/3 of tongue. Okay. And the last is general somatic afferent. Here also sensory. That is also going to geniculate ganglion. What does it carry? It carries the sensation from skin of external ear. Okay. Now you can see here I told you the different functional component. So here is the motor nucleus of facial nerve. Here is the superior salivatory and lacrimatory nucleus, and there is something known as geniculate ganglion. Okay, so you can see here this one is the motor the fibers is coming from the motor nucleus. So these are spatial visceral efferent. These fibers are coming from superior salivatory and lacrimatory nucleus. This maroon color, that is general visceral efferent. And these two fibers are afferent, that is general somatic afferent and spatial visceral afferent. They are going to reach to geniculate ganglion. Out of that, spatial visceral afferent. You see here spatial visceral afferent, that is spatial. So spatial sensation is carrying the test sensation to from anterior 2/3 of tongue. So spatial visceral afferent will be actually going to nucleus tractus solitarius. Okay, solitarius. And another one is general. Here you see general somatic afferent. That is carrying the sensation from skin of external ear. Where does it go? It go to the spinal nucleus and tract of trigeminal nerve. So you can see these are the four functional component of the seventh cranial nerve. Again I am repeating: spatial visceral efferent, general visceral efferent, spatial visceral afferent, general somatic afferent. Okay. Now what is the course of the facial nerve? So first is intracranial or pontine segment. So the nerve arises from the pontomedullary junction. Okay. So it has having two roots. The large one is the motor root and the small one is the sensory root. The motor root is facial nerve proper and the small sensory root is nervus intermedius. These both will emerge from the brain stem. They pass in the cerebellopontine angle along with the labyrinthine artery and cranial nerve 8, and all these nerves will enter the internal acoustic meatus. So now they will form the meatal component about which we will talk here. So you can see here, what you are seeing, three different structure. They are coming and entering into the here internal acoustic meatus. Okay, so in the meatus, motor root is lodged in a groove on vestibulocochlear nerve, and sensory nerve root will be remain separate. Okay, so at lateral end of internal acoustic meatus, two roots unite to form trunk of facial nerve. Now this facial nerve will enter the facial canal in petrous temporal bone. So you can see here, can you see this thick root? This thick root is motor root, this one is the sensory root, and they both are forming a single nerve, that is the facial nerve, and that is entering the facial canal. Now this facial canal, you can see from here to here, this facial canal is divided into three segments. The first one is the labyrinthine segment, which is lying above the vestibule of bony labyrinth. It is bending here. Okay, it is bending here to anterior superior part of medial wall of middle ear. Okay, it is bending here, and the facial nerve coursing through this segment of canal, and here it is taking a sharp turn. Okay, it is taking a sharp turn, and this is known as external genu. Can you see? It is coming like this and taking a sharp turn like this. Okay, so that is the labyrinthine segment, segment number 1. Now segment number 2 is here, that is tympanic segment, or in the tympanic part of the facial canal. So here it is going horizontally in the medial wall of the middle ear. Third one is, this one is the mastoid segment. Okay, so mastoid segment is which is beginning at the junction of medial and posterior wall of middle ear. It is passing vertically in posterior wall of middle ear, and it reaches the stylomastoid foramen at the base of the skull. Understood? So you see here, this is labyrinthine segment, this is tympanic segment, this is mastoid segment of the facial canal. Okay, so then after that, now here through the stylomastoid foramen, the nerve will come out. Now it will be known as extratemporal segment. So facial nerve will come out of the cranial cavity through stylomastoid foramen. It will enter the parotid gland on the superficial plane. It will be running superficial to retromandibular vein, and it is divided into two trunks. You can see two trunks here. This one is temporofacial and this one is cervicofacial. See, this is the extra temporal segment. So it is having two trunks. It is dividing into temporofacial here, and another one is cervicofacial. So temporofacial further giving two branches. One is temporal and another is zygomatic. Cervicofacial is giving three branches. One is buccal, another one is marginal mandibular, and another one is here, the cervical branch. Okay, so these are the branches which are the terminal branches of the facial nerve. Okay, now the branches we will see. So branches of distribution, some branches are intracranial, another are extracranial, and the last are terminal. So what are the intracranial? Greater petrosal, then nerve to stapedius and cauda tympani nerve. Extracranial, posterior auricular nerve, branch to posterior belly of digastric, and branch to stylohyoid. Okay, so these are the extracranial branches, these are the intracranial branches, and these are the terminal branches. Now, what is greater petrosal nerve? It is arising from the genicular ganglion. It is consisting of preganglionic parasympathetic fibers which relay in the pterygoparietal ganglion. It will supply the secretomotor fibers to lacrimal glands and mucous glands of nasal cavity and palate. Another is stapedius. So it is arising from the vertical part of facial nerve and supply the stapedius muscle. Okay, so you see here that will be arising when it is here in the vertical part. Okay, so it is not shown here. Now another nerve is cauda tympani nerve, which is arising from the vertical part of facial nerve. It is entering the middle ear through the posterior canaliculus. It will run across the lateral wall of middle ear. It leaves middle ear by entering anterior caniculus. It will enter the infratemporal fossa, and in the infratemporal fossa it will join the posterior aspect of lingual nerve. Okay, it consists of two types of fiber: preganglionic parasympathetic fiber, that is general visceral efferent, which supply the secretomotor fibers to submandibular and sublingual gland, and special visceral afferent fibers carry the taste sensation from anterior to third of tongue. Then there is posterior auricular nerve, which supply the occipital belly of occipitofrontalis, nerve to posterior belly of digastric, and nerve to stylohyoid. You can see the nerve to occipital belly of occipitofrontalis, the nerve to posterior belly of digastric, and the nerve to stylohyoid. Okay, so all these are branches arising here. These are arising from extracranial component. Okay, terminal branches I have already told you. The terminal branches, you can see the temporal, zygomatic, buccal, marginal mandibular, and cervical. Okay, so you can see here the whole course. You can see the whole course. Here is the facial nerve arising. This is the motor root. This is the sensory root. They both are reaching here where they are forming a ganglion, that is geniculate ganglion. Now from this geniculate ganglion, here is the greater petrosal nerve arising. Okay, this greater petrosal nerve arise and it will join with the deep petrosal nerve, and the both nerve will form combinedly the nerve of pterygoid canal, and they will reach to the pterygopalatine ganglion, and from there the nerve arise which go and supply the lacrimal gland. Okay, now this is the further course of the facial nerve. So here is the geniculate ganglion. Again I am showing this is the sensory root. The smaller one, the thicker one, is the larger one is the motor root, and here is the nerve, this facial nerve. So now it is coming here through the middle ear. So here it is giving supply to the stapedius. Okay, I have already told you about stapedius. Then when it is reaching the infratemporal fossa, it is giving a branch, that is cauda tympani. Okay, so this cauda tympani will go and join here and supply the submandibular gland and sublingual gland, and it will also carry the taste sensation from anterior to third of tongue. Okay, then what other branches are there? I told you before it is giving these 5 terminal branch, it will be giving a branch to the occipital belly of occipitofrontalis, that is posterior auricular nerve. Another is branch to the posterior belly of digastric and stylohyoid, and one more was there. What is that? This cervical branch will supply the platysma muscle. So you can see here these are the terminal branches: temporal, zygomatic, buccal, mandibular, and cervical. Okay, again I am showing you what are the branches. You can see the intracranial branches. Intracranial branches means when it is the facial nerve has not came out of the stylomastoid foramen. So it has given greater petrosal nerve. You can see here this is the greater petrosal nerve which is joining with the deep petrosal nerve, and it is forming the nerve of pterygoid canal, which is going and reaching the pterygopalatine ganglion and will supply the lacrimal gland. Another intracranial branch is nerve to stapedius. Okay, and the third branch which we have seen, that is cauda tympani here. Okay, what are the extracranial? Posterior auricular, branch to posterior belly of digastric and stylohyoid. Okay, you can see here occipitofrontalis. Okay, occipital belly of occipitofrontalis, then nerve to posterior belly of digastric and nerve to stylohyoid. Okay, so this cauda tympani will arise from the intracranial component. Okay, and these are the 5 terminal branches. So you can see the terminal branches as it is coming out through the stylomastoid foramen. It is dividing into 2 trunks. One is temporofacial and another one is cervicofacial. Temporofacial is giving 2 branches, temporal and zygomatic. Cervicofacial is giving buccal, marginal mandibular or mandibular, and cervical. This cervical branch will supply platysma muscle. Okay, then applied anatomy. So disorders of facial nerve can be upper motor neuron lesion or lower motor neuron lesion. Upper motor neuron lesion means above the nucleus of the facial nerve, that is it is central type, and lower motor neuron lesion means it is nuclear or below the nuclear, that is inferior nuclear or peripheral type. Okay, now you see here is the facial nerve nucleus, and After this there is facial nerve, and above this, so if here, if any lesion is there, UMN, it is known as upper motor neuron lesion, it is supranuclear lesion. So if here is the lesion, so there will be paralysis in the lower face on the opposite side, this much. Okay, suppose lesion is UMN lesion on left side, so paralysis will be lower half of the right side. But if the paralysis, if the lesion is the nuclear or the below the nucleus, that is lower motor neuron, so that means the paralysis will be the same side, half of the face. Okay, you can see here supranuclear lesion, that is for example in case of hemiplegia. So here you can see the lower half of the face or opposite side, this is affected. Okay, lesion is here. Now infranuclear lesion means lesion can be here, lesion can be here. So first site is just above the stylomastoid foramen, another site is above origin of chorda tympani, then another is above origin of nerve to stapedius, and another is at the geniculate ganglion. Okay, now I will show you again. Either the lesion can be here where it is coming out through the stylomastoid foramen, that is lesion number 1. Lesion number 2 is just above where chorda tympani is arising. Third one is where the nerve to stapedius arising. Okay, and fourth one is where the geniculate ganglion is present. So you can see here at or just above the stylomastoid foramen. So it will cause the Bell's palsy, which will be occurring as loss of motor function of all muscles of facial expression. There will be deviation of mouth towards the normal side, inability to close mouth and eyes, and accumulation of food in vestibule of mouth. This is happening just above the stylomastoid foramen. Site B is above origin of chorda tympani. So here along with the feature of site A, plus there will be decreased salivation and loss of taste sensation in anterior two-thirds of tongue. Site C is at the above the origin of stapedius. So here feature of site A, feature of site B, and there will be hyperacusis, that means increased sensitivity to hearing. Okay, even a small sound you will be able to hear more. Okay, and site 4 is at geniculate ganglion here. So feature of site A, site B, site C, plus there will be loss of lacrimation because lacrimative gland is not getting the nerve supply. Again I will show you. So first lesion is just above the stylomastoid foramen. Lesion 2 is just above the origin of chorda tympani. Lesion C is above the nerve to stapedius, and lesion 4 is geniculate ganglion. So if lesion A, that means there will be deviation of angle of mouth. The mouth will not be able to completely close. Now if you are here, that means these lesion plus the lesion of submandibular gland and tongue. Okay, now if you are coming here, that means there will be paralysis of stapedius, so there will be hyperacusis. Okay, and here all these feature plus the involvement of greater petrosal nerve, so there will be no lacrimation. Fine, so that is the different site of lesion. Okay, then what is Bell's palsy? It is idiopathic element type of palsy, that means lower motor neuron type of palsy. The most common cause of facial paralysis, okay, etiology is unknown. In many cases it is herpes simplex virus 1. Okay, age group is 15 to 45 years. 30% cases there will be partial paralysis and complete paralysis in 70%. So it is known as Bell's phenomena. It is also known as syndrome of crocodile tears. Okay, then what is Ramsay-Hunt syndrome? It is due to involvement of geniculate ganglion in herpes zoster, so site D. Okay, so there will be herpes vesicles on auricle, there will be hyperacusis, there will be lack of lacrimation, there will be loss of taste sensation, and there will be complete ipsilateral palsy, that means the Bell's palsy. Okay, thank you. So that is today's class. Thank you.